So, I'm a new resident to Puerto Rico. I've been here about 2 years now. I have a background in healthcare. I have a consulting business in healthcare. And I really wanted to have the opportunity to bring these amazing group of women together to think about how do we move forward and help solve some of the challenges that we have, but equally important, how do we start thinking in an innovative way to improve healthcare on the island?
When you think about that innovation, are we talking technology? Are we talking new relationships? What do you envision when you talk about innovation?
Well, a little bit of all of the above when I think about innovation, but certainly technology is pretty exciting in general, but in healthcare, which is, as you see here today, we have a good portion of our discussion on AI. But, really networking, meeting other women, making the connections to think about the ways we can work together to solve problems and innovate and do things maybe differently. I think in order for us to continue to improve the healthcare environment here on the island, we have to do things differently. And this is a room of women who are mothers, executives, children, who are really going to be the ones here to help us solve the problems.
Based on your experience, how would you describe the healthcare system in Puerto Rico? What do you see in the ecosystem of healthcare in Puerto Rico? How do you compare it to what we see in the States?
There's similarities, of course, and there's differences. I think one of the key challenges that certainly in the past year has been talked about a lot is going to be the availability of medical professionals in the next 3 to 5 years. Access to healthcare continues to come up as a key concern for not just women and caregivers, but I think just generally. Wanting to be able to have the number of specialists that we need, the type of technology that we need. So I think solving that problem, and with the retirement cliff that's coming from a medical professional perspective, is going to take some creativity. We're going to need to be able to get more by leveraging technology, whether it's telehealth or artificial intelligence or whatever it might be.
Thank you. Any other message that you want to make sure that people here in the healthcare industry in Puerto Rico know about what's going on here today or about what you're doing?
I just think I'm really impressed with the women that we have here, the women executives, the thinking, the thought leadership, the entrepreneurs, which we're also going to be highlighting today from the island. And I think it's an exciting time to be here.
Thank you very much. Lots of success today.
Thank you.